Hello everyone, Jay Roy here. Welcome back to my channel. I've got my friend Olivia here with me today, so we have some more trans experiences to offer. Been asked another couple of questions recently. These ones we're going to focus on healthcare. And so for us talking about our healthcare experiences, we're going to be talking about Nova Scotia, and we're going to be talking about our experiences from our point of view. So again, just a disclaimer, this is not every trans person's point of view, but this is ours. So without further ado, this is Olivia Jacquard, a good friend of mine, and she'll be giving a trans woman perspective of our questions. And yeah, go ahead and introduce yourself. Give yourself a little intro.
So again, my name is Olivia Jacquard. I've been, as far as for the trans part of me, I've been out for probably about 4 years. Hormones for about, 5 or 6 to myself. Hormones for about 3. And I just go through life. I'm a very nerdy person. I'm personally an aspiring art author and really awesome person. And I help out a lot at the shop when I can.
Yes, she does. So without further ado, we'll just hop into our first topic. Which is, again, it's about healthcare. And this is, we're just going to intro, and we were asked to speak about our experiences with the Nova Scotia healthcare system as trans people. So I'm going to let Olivia take point on that one.
So as far as for, I would say sort of the main sort of point is probably as soon as you start coming out as yourself and trying to worry about the passing and trying to live on with your normal sort of life, it's sort of, you start looking sort of around your shoulder and all that stuff. And I think that's also representative in the healthcare as far as that internal fear. As far as for personal experiences outside of transition, my healthcare practitioner, she's a wonderful woman. I was a little nervous, but when we got down to it and had the chat, which was really just, yeah, so how's the transition going? Because she'd gotten the letters. So personally, doctors are more not pleasantly surprised, but they're like usually, they see so many patients, they're not really interested in like, oh, you're trans? Oh. So it's been pretty smooth when I actually do engage, but there's been a lot of resistance personally. Mm-hmm. When it comes to my transition experience medically, it was sort of it was right before things started really getting more streamlined and more to the point. So I spoke to someone, I got a referral to the IWK, I then started seeing people up towards eventually getting the the referral to go see the second doctor, who then gave me who I'm now on so it was a multi-stepped, which a lot has been cut out since then, but it's, yeah.
Yeah, there was a lot of steps when I was accessing healthcare. There was a lot of gatekeeping that was going on, and this is even just 4 and 5 years ago. So we've done a lot, and we've come a long way in Nova Scotia to make as Olivia says, it's more streamlined now. So there is still a large wait time because there's been such an outpouring of people realizing that they're trans and seeking health care for that. So there's kind of a bottleneck happening right now where there's a lot of people trying to access health care, so there's a long wait time right now in Nova Scotia. But if you have a general practitioner, so for example, my family doctor has been extremely supportive, so I don't have to go through an endocrinologist, I don't have to get any more paperwork, I can just go through my family doctor, he gives me my prescription, I go fill the prescription, and I administer it myself at home, or my girlfriend does it for me. So it's been kind of easy for me in the last little while, but in the beginning there was a lot of gatekeeping. You had to get psychiatric evaluation, and that stuff just isn't required anymore. Moving on, the person who sent a lot of these questions works in the health field in Nova Scotia, and so they were wondering, what can health professionals do to make the experience of trans people better? I'll just start really quickly with saying the first line responders. So when anyone goes into emergency or a walk-in clinic, I really feel that, and maybe this is happening. I think it is. The training is happening, but I really feel like the frontline people need to understand more about the gender spectrum, knowing that not everyone identifies on the binary, and maybe needs to use more gender-neutral pronouns. Even like when people come into my store, I say, "Hi, folks," or how's everybody doing today? I try to stay on that gender-neutral language. So I think the very first thing that could be helpful is if the frontline people who are greeting people in like the very first triage or whatever you have, those people really need to be trained in language, because a lot of the times people can get misgendered and whatnot, and that's very painful. Dysphoria is a very painful experience, and to try to diminish that would be great, because the more people are not using gender-neutral pronouns and things like that going into a medical setting, well, that just discourages people from going in the first place and accessing that healthcare they really do need.
And I think the other thing, because I've been lucky, because generally, I mean, I'm pretty passing enough at this point. But I think another thing is some sort of indicator. It doesn't need to be huge. It doesn't need to be like in people's faces, because there's that worry of the people who are not so blah 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 might be, but like just some sort of indicator, whether it be just to let us know that we are welcome, I think is a really good thing, because that allows a lot of people to, the barriers that they have put up, the walls in interacting with anybody of any sort of authority who are expecting and who have had XYZ of actions, well, not actions, but events prior, allows them to bring those walls down and be like, okay, let's have an honest experience, let's have an honest discussion. I need to access healthcare. They're not going to ask the stupid questions, because they already, as by this sign, I'm welcomed. Yeah, and
I think people need to, like people who work in the health profession need to, maybe listen a little bit more and believe what people are saying. So if someone is coming in and, they assert that they are male, no matter what you might perceive or might think or whatever, just believe them, because that's what they're saying to you. So I guess then the last little point was, what kind of things do we need to consider or adjust? Well, I don't know all the ins and outs of the healthcare system, and feel free to comment, in the comments and further the conversation, and we can certainly answer any questions from there. I already discussed a bit of the language that could change, maybe some sort of indicator letting trans people know this is a welcome space, we will respect you. What else? What do you think that they could do?
I think really just, the as long as there is a situation where you don't have to go in and educate the people who are supposed to already know, there's a reason why doctorates exist. And also being able to have, okay, you're transgender, let's move on to the real thing, not getting stuck on the whole what are your genitals thing, which I don't think is as apparent anymore, at least in my experience. But I still get the one or two people, and I'm comfortable enough to brush it off. But really just education and that welcome door.
Yeah, and I think, with people like, Olivia is a very confident person, and so am I. So going into the healthcare, a situation, we're going to be able to advocate for ourselves. But not everybody, in fact, trans people often don't feel comfortable advocating for themselves, and they really shouldn't have to. When we go into a hospital, at that point, people should just care about the people. They should care about giving someone the help that they need and not get so hung up on definitions. So I think that's a good, starting point for the conversation. So we'll end the video there for now. I'm glad I got Olivia into a video, so thank you for joining me.
My pleasure.
And we'll have you back.
If anyone has any other specific questions towards me, or as far as what's it like to be on hormones with estrogen versus testosterone, or any other specific experience stuff, I'm more than happy to talk about it.
We are open books, so ask us questions. Cool. High five.
All right then. Peace.